have read Puan Aina medicine's story, and I found out that you have been diagnosed with polycystic ovary syndrome, also known as PCOS, as the ultrasound results show the presence of multiple small cysts on your ovary, and your blood test revealed that there are elevated levels of androgens, which is male hormones. You also shared that you have irregular menstrual cycle and often going several months without menstruating. You know that those are the symptoms of PCOS. Basically, PCOS is a complex and common endocrine disorder that affects women's reproductive age. Generally, irregular menses can be one of the factors that leads to the PCOS, and the symptoms can be the length of a woman's period is either less than 21 days and more than 35 days, late or early menstrual period, and painful cramps. So for now, I would like to check your menstrual history, whether your family has irregular menses or erratic bleeding patterns that indicates your hormonal imbalances. So I'd like to perform a transvaginal ultrasound to insert a transducer into your uterus to observe the cyst.
My name is Hakim. I'm Dr. Nasfa. I have reviewed your hormone analysis and ensured that your testosterone level is below the normal range, which is typically between 300 and 1000 nanograms per deciliter. This explains the symptoms you have been experiencing, like fatigue and low libido. Low testosterone level affect your sperm production, which may reduce your fertility. Since we are trying to conceive, it is important to keep your testosterone levels within a healthy range. We will prescribe medication like clomiphene citrate or HCG to help your body reproduce more testosterone while maintaining sperm healthy. Both are often effective for men trying to conceive, as they support both hormonal balance and fertility. Lastly, we will monitor your progress with regular hormone and semen tests and adjust your treatment plan as needed to best support your reproductive health. That's all from me.
Reaching and also endocrinologist regarding your initial treatments, what I will discuss deeper and also suggest treatments that could be good. For Encik Hakim, your low sperm count is due to GnRH secretion to your testes, specifically Leydig cells. To produce testosterone is disrupted, resulting hypogonadism. Treatment that could be taken are PRT to improve your libido. However, this method is not suitable, so we could proceed with scrotal ultrasound, where if we found varicocele, which is an enlarged vein in your scrotum, we could proceed with varicocelectomy. As for Puan Aina, your PCOS is due to obstruction of your HPO axis, also lead to the increasing in the androgen level. When this androgen level exceeds, it will lower sensitivity of progesterone and estradiols, causing hypersecretion of GnRH and LH, which result in irregular ovulation. So I would suggest to use metformin or letrozole as a medication that helps to improve fertility. We could consider to use ovarian surgery to help induce regular ovulation.
Good morning, Encik Hakim and Puan Aina. Thank you for coming in. I've reviewed your test result. My role as a fertility specialist is to offer advanced solution when natural conception faces this kind of hurdle. Based on your specific situation, we are likely looking at in vitro fertilization or IVF. This is one of the cutting-edge fertility solutions we provide. We'll stimulate Puan Aina's ovaries, carefully retrieve her eggs, and then fertilize them with Encik Hakim's sperm in the lab. Next, the embryo will be directly transferred to Puan Aina's uterus. We can even use cytoplasmic sperm injection (ICSI) for precise fertilization if needed. We can directly inject a single sperm into each egg for highly precise fertilization. This method is beneficial if you have low sperm count or abnormal shape of sperm. I'm going to refer both of you to Dr. Mai to go into the detail. Thank you.
Hi, Encik Hakim and Puan Aina. I will explain the process of IVF and ICSI. In the IVF process, we begin by collecting Encik from Puan Aina's ovary after a course of fertility injection. On the same day, we need Encik Hakim to provide a sperm sample at the lab. From there, fertilization will take place in two ways. First, in standard IVF, which we allow the sperm to fertilize naturally with the eggs in a lab dish. And secondly, in ICSI, only a selected healthy sperm will injected directly to the egg to assist fertilization. This method is very useful, especially there are issues with the sperm count or quality. After fertilization, we will culture and monitor the resulting embryos for the several days to assess their development. Select the best quality of embryo and transfer into the uterus at the optimum time to maximize your chances of successful pregnancy. Also, after the transfer of your embryo, you will experience to feel the enlargement of your ovaries and some discomfort may occur.
Assalamualaikum Encik Hakim and Puan Aina. I'm here to support both of you on your journey to parenthood, focusing on nutrition intake that can enhance your fertility. So, Puan Aina, it's important for you to eat balanced meals that include a good mix of protein, fiber, and healthy fats. Choosing a low glycemic index carbohydrate such as brown rice can help keep blood sugar steady and reduce the hormonal imbalance. It's best to avoid sugary snacks, processed foods, as this can spike the insulin and worsen the symptoms. So, including anti-inflammatory food is also crucial, as inflammation can interfere with reproductive hormones. Zinc and omega-3 fatty acids help lower your androgen levels and support your egg quality. Also, for Encik Hakim, food rich in zinc like pumpkin seeds and moderate amount of red meat can support your testosterone production. Healthy foods such as those found in avocados, olive oil, and nuts are essential for the body to produce your sex hormones. And lastly, to support your energy levels and libido, nutrients such as magnesium and B vitamins are especially important for managing stress and reducing fatigue.